Good afternoon, everybody. I am Bray Lake, and I am thrilled to be here at DevDays with you as a patient innovator. The title of my talk is I'm entering to shine a light on the void. And honestly, I think I am a little more of a patient paper pusher than a patient innovator. I think a lot of the cool kids and early adopters come and talk to you about the great things they've been able to do with their health data, and I am totally not that person. In fact, I have been able to do nothing with it. So I have managed to collect my health data and compile it into some completely worthless notebooks of PDFs and disks. I've participated in things like the Get My Health Data Challenge and done some other activities for patients trying to make something useful of their medical record. And so far, I've got nothing, but I really need your help. So I'm kind of one of those patients that I look completely normal, but I've had some really weird health events where I've become paralyzed and unable to speak out of the blue. I've had horrible migraines. I've had some really rare adverse events happen with medications that are very common. I've had a lot of procedural related complications. I've had post-op bleeds. And I also have a lot of implanted medical devices, which again, you look at me and I look totally normal. And so I'm extremely challenged to aggregate all this information and tell a very complex health story very rapidly. So the first thing that I really need your help with is creating a record that is useful in emergencies. And I know somebody out there is going to think, well, there's some great apps that do that, but I have implanted medical devices and those are nowhere in those apps. And even in my EHR, I definitely suffer from hyperportalosis where I've got multiple patient portals across multiple health systems. And depending on which door I go in, some of the providers may not have access to that information. In fact, the majority of them, which is very scary. I was recently in a car accident and actually refused to go to the hospital because it wouldn't have been the hospital that had my medical records. I have gone so far as to even create these cute little snapshots of where devices are implanted in my body and who implanted them. But I didn't happen to have that on me the night that I was in an accident. And I was also so out of it that I'm not sure I could have produced it. But what's really important is that a lot of these devices have specific requirements for imaging, such as MRI. And so you need to know what the Tesla rating is, if they're able to withstand that type of scan. And so if I'm not able to communicate for myself, I need this information to be readily available. So what's the device? Where's it located in my body? Who made it? What's the date of implantation? Certainly any imaging guidelines for the device. And then it would be terrific to even have pipelines built to these images, whether they're stored in a cloud or being accessed through a health system. It's really key that I get access and my providers get access to this information urgently, particularly in an emergency. The next thing I really need you to do is create a longitudinal visualization of health. So the closest thing I've seen was created by the brilliant Katie McCurdy at Pictal Health. Somebody should call her, see if she wants to collaborate. She was hand illustrating her own patient stories and now does that for others. But I've got this story that now dates back, almost 20 years, and appointments are 15 minutes. And so trying to jump into an appointment and say, this is what happened, back in 2004, and then bring people up to speed very rapidly. I need to really be able to visualize in what I would call almost a visual Richter scale of when an event occurred, how serious it was, what was the symptom burden, and what was the magnitude of impact on my life. And so somehow I think we need to pull these things in and have it be, a tech export of some kind that basically looks similar to what a visual resume is. So I could go into a visual resume software and enter, my education and the history of my employment and my commitments, and you could see professionally the years that I was really prolific in publication or activity. So why can't we do that for basically my health events and my symptom burden? That would be brilliant to just be able to, dial back year to year and show kind of the ebb and the flow of what's happened in my life. The third thing I'm going to ask you to do is help me accurately capture medication use. So our traditional data capture right now really looks at when a provider prescribed a medication or when a medication was filled if we're looking at claims data, but it doesn't say anything about how and when I started taking it, what happened when I took it. If I'm not taking it, why is that? Is it that I couldn't get it, or is it that I had unpleasant side effects, or that I had some type of serious adverse event? It's really, really important that we know when patients started these medications and if they're even accurately using the types of medications. So I'll give you just one example. I started a medication after heart surgery. It was Plavix, so an antiplatelet medication. It happened to disagree with me. And unfortunately, I had joint pain and nausea, and I became extremely ill, vomiting. I had petechia, my blood vessels were rupturing. And I ended up in the emergency room, which of course, being a woman in her 40s, actually I was in my 30s at the time, they said, you know, the differential diagnosis was anxiety, which is incredibly frustrating. They said I was just anxious because I'd recently had heart surgery. Well, thank goodness they did a blood test. My liver enzymes, my ALT was actually 33 times what my normal would have been. I was discharged with not a lot of information, but my primary care physician said, please stop taking that medication and let's see what happened. And so within a week, my liver enzymes returned to normal. But if you look at my health history and you just look at these labs, that's not contextualized in any way. You have no idea that I was actually taking a new medication and that this is what happened. And then when I stopped the medication, my labs returned to normal. So that is crucial that we start to really start giving the patients the opportunity to work with their providers and contextualize this information in some way. And then, of course, I would like to pull that into my master record so that it doesn't only just say, you know, I have an allergy to this medication, it can show what actually happened. The next thing I'm going to recommend is that we really start to layer our electronic health records and medication information with person-generated health data. So I think we all know that through smartphones, sensors, wearables, we're all generating this data that's passive and continuously being generated and can be collected to really take what's currently invisible in our health and make that more visible. So right now, credit to Evidation Health on this visible invisible graphic, we're basically right now, we're just capturing these episodic snapshots that in no way tell the whole patient story. I found this great post in a public Facebook group, actually it's a Facebook page, Millions Missing Voice Global, that told a story of this young woman who says, you know, here's what you see. I look normal, healthy, and she's beautiful. And then everything around her, fatigue, brain fog, tachycardia, migraines, flare-ups, medication, insomnia, all these things that are floating around her head, like that is my experience when I had an exacerbation of health. Not only would I have migraines, I'd have dysautonomia, which is the most frustrating thing to try to capture and explain. I had tachycardia. You can guess that if I went into my cardiology office and did, you know, my EKG in the office, it never caught anything. But yet through devices, we now can actually capture that, you know, in real life, in real time. And so this type of information has got to be layered in with all these other things. And then it's got to be contextualized, and we will start to have these representations of what is known as the behaviorgram. So you can start to see, you know, what a patient's true burden of illness and experience living with a disease is on a daily basis. If you looked at my sleep, you know, that would be super telling, and it has a huge impact on my quality of life. And again, it's something very frustrating to try to treat or explain, but now we've got devices and we can actually record this information, but I want to layer it with what my medical experiences are, and certainly with any new medications that I'm starting and stopping. And lastly, I'll just leave you with this, that person-generated health data is extremely personal and sensitive, and we really have to ensure that there are appropriate protections and mechanisms in place where patients can permission that data flow. So if we want it to go into a clinical encounter, you know, that's our business, and we should be able to approve that. If we want it to be integrated into our EHR, we should be able to have that control and permissioning. And certainly we should be able to decide if we'd like to share our data for research. So please, please, please just make sure that whatever you come up with that helps me achieve these goals, that patients' data never ever leaves without their knowledge or in the dark of night. So this has been just a really brief overview. I know that we only had 10 minutes to power through, but I just want to say thank you. Please use technology to help me create a useful snapshot of my health that captures the critical medical device information and pipelines to imaging, longitudinal pictures, and visual Richter scales of health, events, and exacerbations. Please capture how and when we're using medication, and if we're not, why not? Layer in passively and continuously collected person-generated health data that has now been contextualized. We have great opportunity to ask patients and push out EPROs or surveys and have patients actually, you know, verify or contextualize what's going on in real time. And so all of this should become part of this longitudinal record that I so desperately seek. And always, always ensure that protections are in place for patients to control the flow of their own health information. Thank you.